Hello guys, this is Dr. Nesco. So we are talking about the rheumatic fever today, and this is the same information in the Toronto notes, no difference. So we are reviewing the Toronto notes actually. Rheumatic fever is an inflammatory disease resulting from the body's immune response to a group A streptococcus infection. Primarily affects children with a much higher prevalence in developing nations. The clinical diagnosis is based on Johnson's criteria. Okay, here is the incident. Rheumatic fever affects approximately 1 out of 10,000 children in the developing world. So the Jones criteria. The clinical diagnosis is based on the reverse Jones criteria, requires a combination of major and minor symptoms along with evidence of preceding streptococcal infection. The diagnostic evidence of strep infection includes a history of scarlet fever, positive group A streptococcus pharyngitis culture, positive rapid antigen detection test, or elevated ASOTS. So the treatment and prophylaxis. We have treatment with penicillin or erythromycin for a duration of 10 days. In a case of severe carditis, we use prednisolone, may be administered to mitigate inflammation. So the prophylaxis is after the acute phase, patient requires secondary prophylaxis with daily penicillin or erythromycin to prevent recurrent episode of the rheumatic fever and associated complications. The complication of rheumatic fever can lead to both acute and chronic complication, includes cardiac aberration, valvular heart disease, and infectious endocarditis. So here is it. Cardiac complications, acute complication may include myocarditis, conduction system, valvulitis, and pericarditis. So the conduction system problems is sinus tachycardia, atrial fibrillation, and other conduction abnormalities may manifest as acute complication of rheumatic fever. Valvulitis and pericarditis, inflammation and damage to heart valves, particularly mitral valve, are common acute complication along with pericarditis. So we have latency period. After acute phase, symptoms may manifest 10 to 20 years later, significantly or signifying the onset of the chronic complication. Valvular heart disease chronic complication includes the development of valvular heart disease such as mitral valve aortic insufficiency and stenosis, as we mentioned before. And one of our others is endocarditis and thromboembolic problems. So the patient may have thromboembolism due to this infection. So the public health measure emphasizing the community-wide group A streptococcus infectious prevention measures such as prompt treatment of the strep throat and prophylactic antibiotics for high-risk individuals. So we have to educate people about that. This kind of infection will be really dangerous for life, and especially in the children. So this one is specially made for the pediatric in the Toronto notes about rheumatic fever. So one of the things which we have to emphasize is vaccination strategies. So vaccination is really important thing which is affecting on the reducing the um, uh, probability of getting such infection, and the on times therapy also is really important for prevention and prophylaxis. So of course also it's affecting on the healthcare system, and economically it's also so important to cure this kind of infections on a time, because we will have healthy individuals which in the future they can work better. That's why we have to treat the children in these situations very well before getting rheumatic fever. So an infection with streptococcus, we have to be careful and have to have a strategy for treating the patient.